thank you again for having me. This is a terrific pleasure. And I celebrate with you this day, this moment, where we finally have an option, a vaccine option for children 5 to 11 years old. We remember that first wave of COVID. We felt lucky in pediatrics because it skipped children to some degree. We felt like it did. The Delta wave is different. And we've seen severe disease in children, and really highlights the need for vaccination. You've gone over the numbers, they're pretty compelling. And while those numbers may seem low to some people, I can tell you, caring for and ministering to families in the ICU, seeing them in the emergency department, only one is what's needed to really have an impact on a family and on a community. And so thousands and thousands of children have in fact been affected. Remember that the purpose of vaccines is to prevent severe disease. And really the goal is to improve community health. And so I'm thrilled that we addressed and took care of our elders first, and in a systematic way took care of our non-elder adults. Then we took care of our 12 to 17-year-olds. And now we didn't copy and paste the study and just do the same thing in 5 to 11-year-olds. We use science and realize that we can be very effective with a lower dose, with less side effects, frankly, almost no side effects for children 5 to 11, and really take care of them so that not only will we not see those consequences of natural infection, but really confer vaccine immunity to 5 to 11-year-olds, spare them the consequences of this terrible infection, and raise community health. I think it's a fabulous moment for everyone.
Thank you. Thank you so much. COVID, of course, is a big part of our concern this winter for our children. But the winter respiratory viruses are more than just COVID, right? There's COVID, we have RSV, and of course, every year, the flu. What advice can you offer families about how they can best protect their families from these winter respiratory illnesses?
No, great question. So we're anticipating RSV, flu, COVID, of course, rhinovirus, and all of the kind of the usual suspects of winter viruses that show up every year in a predictable way. COVID does change things. I think that what we learned in 2020 is, in the pre-vaccine era, we know what works. The toolkit works. There was a bit of controversy, of course, early on around masking. Does it work? Does it not work? At this stage of the game in November 2021, it's a no-brainer. It's a non-issue. Wear your mask when you're around other people. Get vaccinated now that we're in the vaccine era. Keep your distance. Keep your hands clean. Avoid large groups. So we know what works. And we now have a vaccine. And so I think this is just such a terrific time to be able to really kind of turn the corner on this pandemic and get a little more control over the spread. And so I'm looking forward to seeing the 5 to 11-year-olds get their vaccines.
Yeah, and you know this well as a physician who practices in a children's hospital, that all along the picture has included real concern about what the overall impact of these respiratory viruses making children very, very sick might have on our hospital beds, and the ability of our hospitals to really have the room, really have the capability of caring for other illnesses as well, including simple things like a fracture from falling on the ice in the winter.
Yeah.
Can you tell us a little bit more about why it's important for us to take common sense steps now so that we help alleviate the risk of severe pressure on our children's hospitals this winter?
No, absolutely. Thank you for asking that. We've learned a lot from, again, 2020 and the value of the toolkit. What we're really talking about is community health. And our healthcare system is a shared community resource. And so our individual decisions have an impact on the availability of that shared community resource. We have some hard facts in healthcare these days. We lost over 500,000 healthcare workers in 2020. They didn't go from one hospital to the other. They left healthcare altogether. And so we have had to innovate throughout the country and certainly in our state, collaborating with our partners throughout the region to make sure we can still deliver high quality care. The way that we can continue to move in the right direction as a community to preserve and elevate community health is to make sure we're doing the things we know to do. I'm very aware of the fact that public health really starts with private choices. And so I really, really I can't beg anymore to really make the right choice when it comes to exercising all of the elements of the toolkit, right? Keeping your distance, washing your hands, getting vaccinated. And again, thank goodness we now have a vaccine for 5 to 11-year-olds that can really begin to contain the spread so that we can have capacity to do the things that a high quality healthcare system like ours in Ohio is capable of doing. And we're not overrun with preventable disease.
Thank you so much. Thank you so much, Dr. Forbes. Next, I'm joined by Dr. Patty Manning-Courtney, pediatrician and chief of staff at Cincinnati's Children's Hospital Medical Center. Dr. Manning, the Gamble Center for Vaccine Research at Cincinnati Children's has in fact taken part in COVID-19 vaccine trials. And it's my understanding that more than 350 children have been a part of these trials. Can you tell us a little bit about what you've learned through this process, particularly in terms of the confidence that parents can have about vaccine safety and the effectiveness of the vaccine for this new age group, 5 to 11 years old?
Thanks, Dr. Vanderhoff. And I just want to echo the enthusiasm and the celebration that we're feeling here in pediatrics and at Cincinnati Children's for the ability to vaccinate this age group now. We are very proud to have participated in these vaccine trials, and we're proud to have had children in our region and our own neighborhoods participate in these trials. And from them, from those children and from these trials, we've learned that this vaccine is incredibly efficacious. It works. It is very effective at preventing disease, and COVID is now a vaccine preventable disease. The other thing we learned about the side effect profile, interestingly, is that the side effects are really quite similar to those that were reported in adults, but in children, they're actually less frequent and less severe. And I don't know if that means that children are more sturdy. I suspect that that could be the case, but children have tolerated this vaccine very well, and they have benefited. So it's safe, it's effective, and it's the right thing to do.
Thank you very much. Now, we know that parents, when it comes to their children, are really only concerned about what's best for their children. And there can be concerns about something new, especially a vaccine. And I know I've heard parents express concern about longer term potential consequences. What about fertility for my child down the line? What about what I've heard about myocarditis and pericarditis? Can you speak to those concerns that parents may have as they're contemplating this newly approved vaccine for their children who are 5 to 11 years old?
You know, I have great respect for the processes that families go through, parents go through when they make decisions on behalf of their children. They are the stewards of their children's health. And so, you know, we greatly appreciate the thought that they put into these serious decisions. And so it's with great confidence that I can say that some of the concerns that have been raised about vaccines, and I'll speak first to fertility. The short answer to that question is no. There's no impact from these vaccines on fertility. It's a sometimes an unsatisfying answer to give, because the seeds that were sown around this risk were based in some very incorrect science. And so to simply say it's wrong, that's not true, sometimes doesn't feel robust enough to some families. But physician after physician will tell you that's simply untrue. There's no evidence whatsoever that fertility is affected by these vaccines. The second issue, you already spoke to myocarditis. It was not seen in our cohort of vaccine trial participants, which was great. Even when it is seen, it's very mild, and it is 6 to 7 times more commonly seen when you get COVID. So if you're worried about myocarditis in your child, you don't want them to get COVID. And if you don't want them to get COVID, you want them to be vaccinated. And the risk of myocarditis is exceptionally low. And then the third item around long-term effects, we hear this a lot about this new vaccine and that there's not been enough time. But we know two things about long-term effects related to COVID and the COVID vaccine. We know that vaccine side effects happen within the first 6 weeks. We know this from the COVID vaccine being administered to billions of people worldwide now. And we know this from other vaccines, that vaccines don't live in your system long-term. They go away, they do their job, they stimulate your immune system, and then they go away. We also know for certain, we've seen it directly, that children can have long-term side effects from COVID. So if you're worried as a parent about long-term side effects, you really should be concerned about the risk of COVID. Even mild COVID in a child has the risk of long-term side effects. The vaccine does not. The vaccine will prevent that risk of long-term side effects from COVID.
Dr. Manning, I'd like you to elaborate a little bit further on that point that you're making, because it's one that I hear from caring parents all the time. And it's that, well, my understanding is, doctor, that most children get a relatively mild case of COVID if they get COVID. Aren't I better off letting them just get that mild case and get through it than I am subjecting them to this new vaccine? What's the response that you would offer a parent who's having that concern?
My first response to that is that it feels like an unnecessary risk to take, that your child would get COVID and that you're banking on it being mild, when in fact we've told you many times that we see children every day, including today at Cincinnati Children's Hospital, hospitalized with moderate to severe to quite serious COVID. And we can't tell you who that child will be. So you may gamble that your child would get mild COVID, but nobody could guarantee that that would be the case. They don't necessarily have to have pre-existing conditions. Some of the pre-existing conditions that do increase the severity of COVID are very common, things like asthma and obesity. And so going the route of sort of natural immunity or let them just get the disease feels like a risk to take with your child, when we can tell you confidently that this is a vaccine preventable disease. And vaccines have prevented diseases and death in so many children in other ways. And COVID is causing many deaths. You gave some striking numbers earlier in this call about the number of deaths that we've had from COVID in children. So I would say that the risk is far greater if you want to take the chance of your child getting COVID than from the vaccine.
Thank you, Dr. Manning. Well, finally, I'm joined by Dr. Michelle Dritz, a pediatrician at Cornerstone Pediatrics in Miamisburg, and a delegate at large to the American Academy of Pediatrics for the Ohio chapter. Dr. Dritz, we know, and Dr. Manning just outlined this, that vaccines are an important part of keeping our children healthy, and that regular childhood immunizations, and I'd include the flu shot, can really make a difference in terms of saving lives and improving their health. The COVID-19 vaccines, of course, can be given at the same time a child gets a flu shot or another vaccine. Can you share with parents a little bit about why it's important to not let our children get behind on their shots, why it's important to stay up to date with those shots, and maybe be thinking about that when they're thinking about getting the COVID vaccine for their child?
Yes, thank you, Dr. Vanderhoff, for having me. I think that what we've already heard from Dr. Forbes and Dr. Manning emphasizes that point. I mean, vaccines, not just our COVID vaccine, but all the vaccines that we have available do a wonderful job of protecting our kids from all sorts of preventable illnesses, and unfortunately illnesses that for some people can be deadly. So the more that we can make sure that we're getting our kids vaccinated, both against this preventable COVID infection, as well as for all the many other preventable infections that luckily we don't see as much today because of the effectiveness of vaccines, the better. And I think after coming out of and continuing to be in this pandemic now for almost 2 years, we've seen a really significant drop in children getting many of the normal preventable vaccines that they've been getting over the years. And so we're in catch-up mode when it comes to their typical childhood vaccines, as well as now moving into this next phase wonderfully of having something that helps us prevent the COVID infection.
I think that it's probably fairly evident to those who are participating in this briefing that we've got 4 doctors who are all very, very excited about the advent of vaccination for this age group. But this is an age group that has been adjusting and learning to deal with the virus in so many ways, whether it's doing more with hand hygiene or sneeze etiquette or wearing masks in school. Can you just share a little bit with the parents and families about why this vaccine for this age group is something that makes physicians so excited, why we're so pleased to see the advent of the COVID-19 vaccine for 5 to 11-year-old?
It's a game changer. I mean, of the many things that we know that can help protect us against any sort of illness or infection, especially the effectiveness we have seen with the COVID vaccine in the adults in the teenage range in terms of reducing complications, hospitalizations, death, and even infection. And as to Dr. Manning's point, even sometimes mild infection, we are seeing long-term complications with our kids and with our teenagers. So anything that allows us to really maximize that ability to protect our kids, I embrace wholeheartedly. And the COVID vaccine definitely is one of those. It certainly still goes hand in hand with the many other ways that we know have been effective in helping us fight against the coronavirus, like masking, like hand washing, like distancing, and trying to minimize how many people are around at one time. But hopefully, the more we're able to get our community vaccinated, the more we'll be able to pull back some of those other protective factors because of the vaccine's effectiveness in helping protect all of us, including our kids.
Parents really trust their child's doctor and routinely come to them with questions about their child's health care. I'm sure you're fielding, along with your colleagues, questions all the time about COVID-19 and especially now about the vaccine. Is there a specific, or is there a message or a theme that you're encountering frequently that you'd like to share with parents who may have some concerns about the virus and the vaccine?
Well, I mean, I just really start off that conversation asking them what questions they have, because at the end of the day, and I tell this to my families and to all the parents and the teens and the kids that I see, I wouldn't recommend anything I wouldn't do for myself or for my own kids. And this is a vaccine that I've seen the research, I've watched the science, and I know it is both highly effective and safe. And that gives us just one more tool in our tool belt to help keep our children safe. And as parents, that's all we really want to do. Especially to Dr. Manning's point, if we're, as parents, if our goal is really to try to minimize the risks, to try to keep our kids as healthy and safe as possible, well, then we see now that the vaccine helps us do that much better. So please join me in getting our kids vaccinated.
Thank you so much, Dr. Dritz. Well, we know without a doubt that vaccines really do save lives. They've protected us for years from diseases that thankfully are now incredibly rare. Diseases like polio, measles, and mumps. Now, the COVID-19 vaccines can help us better protect our school-aged children and prevent them from becoming seriously ill or bringing the virus home